Hi everyone, I'm Laura.
I'm Asia.
We're pediatrics residents here at the University of Illinois College of Medicine, Peoria, and we'd like to give you a tour of our nursery. So welcome to the newborn nursery here at OSF Children's Hospital of Illinois. In the newborn nursery, we learn to care for well newborns who are safe enough that they can stay in the room with their mother.
We strongly support keeping mothers and newborns together in the same room. We encourage early skin-to-skin interactions and provide significant support for breastfeeding. For our breastfeeding mothers, if there's a medical necessity for supplementation, we work very closely with our lactation team to provide a safe feeding plan, including donor breast milk as needed.
Although most of our newborns are very well, one of the important skills that we develop here is differentiating between a healthy newborn and a newborn who's starting to get sick. Although most of the kids here are very healthy, we have to look out for things that might indicate that they need to be transferred to a higher level of care like our NICU.
For example, a newborn that's having tachypnea could have transient tachypnea of the newborn, but as pediatric residents, we have to make sure that we keep our differential broad and think of other things.
Some of the other things we think about is hyperbilirubinemia, hypoglycemia. We look out for babies who might be losing too much weight, especially as they're getting close to discharge. We have to look through mom's labs and make sure that there aren't any infectious components that might be risk factors for our baby. So although the infants are well, we do a lot of work to make sure that they're getting the care that they need.
On busy days, our census may reach 25 to 30 babies. In a high volume nursery, it's easy to kind of assume all the babies are the same, but as part of our training, it's important to hone in on skills to treat each baby individually so that you don't miss any subtle cues or signs that baby needs higher level of care.
Residents in the nursery participate in family-centered rounds. Family-centered rounds is what we do when we round at the bedside with the family, and we include them in our conversation and our plan of care for the day. Another thing we do with the families in the nursery is we talk a lot about discharge planning and how to go home safely with a new baby. So that includes things like giving them guidance on what they can look for, signs and symptoms of sickness in a newborn. We talk to them about when to expect the umbilical cord to come off and how to wash their babies. We talk to them about supplementing vitamin D and a host of other things. So we really spend a lot of time with our families here as well.
We also work closely with nursing, lactation consultants, social work, family connects, and our charge nurse, especially with our families when figuring out social determinants of health.
The newborn nursery is a really important place where we develop our communication skills. We spend time talking with families, we spend time talking with the team, we spend time talking with our nurses and our lactation consultants about how our families are doing and what barriers might be for them going home. So all of this is an important part of our training and learning to participate in caring for newborn babies and their families.
Our goal is for residents to leave this rotation feeling like they got comfortable taking care of newborns, coming up with a differential diagnosis, and feeling like outstanding and competent pediatricians who can take care of newborn babies. Thanks for joining us on our tour of the newborn nursery. We hope to see you come train here soon. Bye-bye.